Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, would like to welcome you all. As you know, I am MD in Ayurvedic medicine, that is Kai Chikitsa, and MD in Ayurvedic physiology, that is Kriya Sharira. My dear friends, today's lecture is regarding the Swasthavritta subject. Okay. Here, actually, you must try to understand everybody that whatever Dr. Deshpande is teaching, it's a type of the what you can say the facilitation. That means I am giving you the stimulus to work with your own, because huge portions are there in each subject, and it is very impossible to take each and every line over here. So these are type of the guidelines. These topics whichever I am discussing are very much important, and after my lecture, immediately on the same day, I request all the students to open their own word is important, purchased textbook, because at least minimum one textbook of each subject every student should purchase, then only the study is possible. Unless you cannot rely wholly on the lectures of the classes and wholly on the library books. Better way, every student should invest some amount in purchasing the textbook. Now, for example, today we will discuss about the Ashta-Siddhi. We have nearly at the end of the yoga important points. This is Ashta-Siddhi. I request all of you, please write down the date, 5th of November 2023, 5th of November. And today, this is the lecture of Swasthavritta. We are discussing Yoga and Nisargopachar. So in the index of your notebook, you write down Yoga and Nisargopachar. Now, in the inside of the page, you write down the Ashta-Siddhi. Some words, I always telling you that some words you must write down as a keywords. Now we are discussing these points. Okay. What is exactly Ashta-Siddhi? Because of the yoga, the person gets a maximum power physically and mentally. Write down powers, physical and mental, outstanding power than the normal human being. Extra power, you can say. Siddhi is like an extra power. Why this is happening? Because in that yoga person, sattva guna, please write down, sattva guna gets increased. And because of that, that person gets this type of the powers. So at the moment, you just write down these names, and after lecture, you can write down some of the meanings of all this. First is Avesh, then Chetaso Jnanam. Cheta means mana. Cheta means mana. Chetaso Jnanam. Arthanam Chandataha Kriya. By chance, if I get the time at the end of the lecture, I will try to explain each and every word. But write down, now you have to write down minimum 8 names, so that you have to learn by heart. These will be this is very important question for the examination. They will write down yoga siddhi kar bhav, yoga badha kar bhav, ashta siddhi. So these are very popular questions. So drishti, shrotra, smruti, kanti, svecha, adarshanam. Only few things I will try to explain. For example, drishti. This yoga powered person can see which normal person cannot see. Such a long, that means I am in the Pune now, and I can see what is happening in the politics in the Mumbai. I can see my eyes. It is really impossible. But still, if anybody has such a strong power, then he can get such a vision that he can see the thing which the normal person cannot see. I think this, even he can see the past, whatever happened in person's life. Suppose it's like a miracle. Like an astrologer, he is telling about that in the last 10 years, you had this particular accident, and after 5 years, you will get this type of the benefits, or you will get the Padma Shri or the Padma Bhushan. So such thing, telling about past, present, and future, extraordinary. Please write down this word, extraordinary power to the yoga person is called Ashta-Siddhi. Extraordinary power getting yoga person rather than the normal person, because of the sattva guna, are called Ashta-Siddhi. Second, shrotra. He can hear such a minute things which the normal person cannot hear. Okay. Then smruti, tremendous memory, tremendous flash. It's called as a flash memory. Once he see, he will not forget till his the whole life. Then kanti, color and complexion. He will be so bright and luster that everybody will be attracted towards him. So just few words I have explained, but you have to prepare the whole note on Ashta-Siddhi. Next topic is also important from the practice and examination point of view, Shata Chakra. Very, very important. Actually, Shata Chakras are there. You must remember, write down the name at the moment. Write down, please write down. Muladhara, be quick. Swadhisthana, or you can take a flash, click, screenshots, and audio recording. So you can hear all the time. Okay, Muladhar, Swadhisthana, Manipur, Anahata, Vishuddha, Ajna Chakra. Learn by heart. All these, the screen, whatever the Deshpande's lecture, you cannot make option. Each and everything you have to learn by heart. Then only you will get a little bit success. Muladhar, Swadhisthana, Manipur, Anahata, Vishuddha, and Ajna Chakra. Now, what are actually these chakras? They are not the anatomically, you cannot see those things. Of course, we can compare, but these are the points in our body that we can stimulate. Those particular points, those particular areas, we can stimulate by mantra chanting, meditation, and then you get a lot of benefits of that particular region. For example, Muladhara Chakra is a pelvic plexus, pelvic region around the anus, in between the urethra and the your anal opening. There is a Muladhara Chakra. Then Swadhisthana Chakra, please write down, hypogastric, like in the stomach, hypogastric or other umbilicus. Swadhisthana Chakra, Muladhar, then Swadhisthana. That just wait. I would like to rectify. Please correct those sentences. Muladhara Chakra, please write down. Muladhara Chakra, that is correct. That is anal opening and the urethra. Then I am talking about the Swadhisthana Chakra. Swadhisthana Chakra is what you can say around the region of urinary bladder. Around the region of urinary bladder. That is Swadhisthana Chakra. Okay. Then Manipura Chakra is umbilicus, umbilical region, Grahani Avayav in Ayurveda. Most important, Manipura Chakra, digestion. Then next is a Anahata Chakra near about the cardiac region, in the chest. Anahata in the cardiac region, in the chest. Then Vishuddha Chakra here. Now you can see the screen, here. This is Vishuddha Chakra. And here at the top, can you see? This is Ajna Chakra. So it is coming from the below to up. And yoga says that in our vertebral column, where is the spinal cord, in yogic language, it is called as Sushumna, central neurological thing, Sushumna Nadi. And on both sides, Ida and Pingala, right and left. Okay. So these are the something energy flow. According to Yoga Shastra, it is called as a, compared to the nervous system, but that is a energy flow of the body. And these are the specific places where there is a, what you can say, the central post. All the energy has been accumulated at that particular Muladhar, Swadhisthana, Manipur. And that energy can be stimulated by mantra chanting and meditation. But anything will be asked in the examination. You will ask, describe Manipur Chakra. 3 marks. Describe Swadhisthana Chakra. So please make the notes of each chakra where you have to write down sthana, that is area. Then it's imaginary. Dala means it's like a petal. It's like a lotus flower. Everywhere there is a lotus flower. And they are measuring the petals, how many petals are there to that flower. Then that dala, it is called a dala. A specific name has been given for the chanting the mantra. Sha, va, sha, sha, sa. I am sorry to say, but one has to learn by heart. It doesn't make much sense in our practice. Then Varna, also they have described the Varna of each region. For example, Muladhar is a Rakta Varna and Nama Tattva, that is a Prithvi. So there are nearly 11 points about each chakra. 11 points, please write down, 11 points for each chakra. And like this, Tattva Bija, then Devata, who is the god of that chakra, Yogika Shakti, Jnanendriya, Karmendriya, and a specific var, that is a day, Sunday, Monday, Tuesday, Wednesday, etc. So there are nearly 11 points of each chakra, which you will have to make notes of your own. Okay. Now I will describe about this Bandha and the Mudra. Please concentrate on the subject Mahabandha. Can you see the cursor? Can you see cursor? Just write down these things. Bandha and Mudra. Please write down Bandha and Mudra. So, what is Bandha? Bandha is like giving the pressure by a specific posture. Giving the pressure of the different parts of your body by a specific posture is called as bandha. It's like a bandage, right? Bandha. For example, Jalandhara bandha. I am showing you here. I am touching my chin to this particular sternal part. So this is, if I do the meditation in this position, this is called as a Jalandhara bandha. Jalandhara bandha. So there are different bandhas like Uddiyana bandha, Jalandhar bandha, please write down Uddiyana bandha. Then Moola bandha. This is very important, Moola bandha. That is a akunchana, constriction of your anal part. That is called as a Moola bandha. Then there is also Jalandhar bandha. Okay, Jalandhar bandha. Next is a Mudra. So Moola bandha, here you can see contract anus and perianal muscles. That is very useful also for the practice of incontinence of urine or erectile dysfunction. So this particular exercise, this type of exercise, yogic exercise. Then Jalandhar bandha, as I have mentioned, here, keeping the chin on the chest like that. You can see that. Then Uddiyana bandha, lift the diaphragm and pull the abdominal organs towards the back. That is, lift the diaphragm. This is a yogic practice with control of the what you can say is your respiration and concentration. Next topic of today's lecture. I'm sorry, my dear friends. Just give me some time to adjust the screen. Naishthiki Chikitsa. This is also a type of short note SAQ. So you have to prepare the notes of each and every topic. Chikitsa tu Naishthiki ya vina aushadha. Please write down, without medicine. What is Chikitsa means treatment. Treatment without medicine is called Naishthiki Chikitsa. Devoid of desire. Because all the problems we are getting because of the craving, we are greedy. We want the money. We want the name, we want the fame, we want the money. So all these cravings, because for living, we need very few things. But the people are very greedy and they had a lot of desires, and that's why there are some problems. So liberation of the miseries. This is the purpose. If the person is conquered his mind and he stops greediness, then automatically he will lose all the tensions and he will be happy. Desire is the most cause for all the miseries. Desire, Trishna. Please write down the Ayurvedic word. Trishna, Charak Samhita. Sacrifice of all the desires is the factor to vanish all the miseries. Okay? An illegal person avoids the objects considering them as a dangerous fire. Who is having the intelligence, he avoids the things, because now you can see the people are always gaming, mobile gaming. Or they play rummy because they feel that because of the advertisement, I will get immediate 1 lakh rupees with this just numbering. But that is false. That is false. You trap into that all the gimmicks, and then you lost your mental and physical health, and you start the diseases like blood pressure has been raised. You get the cardiac problem because of the tension. You start eating sweet substances, etc., etc. So that things should be avoided. That is called as a Naishthiki Chikitsa, is a control of mind. Control of mind is a Naishthiki Chikitsa. Now, my dear friends, I will try to shift my screen on the right side to show you we are starting title Nisargopachar or Naturopathy. Nisargopachar or Naturopathy. Lot of questions are there on this topic also. So I will mark for you. Just wait. Okay. Body has a vital capacity which can cure diseases by nature. Sarvam idam panchabhotikam asmin arthe. The nature is composed of 5 basic elements. Pancha Mahabhuta. Please write down. Nisargopachar is based on Panchabhotik Siddhanta. Sarvam idam panchabhotikam. Prithvi, earth, Aap, water, Tej, fire, Vayu, air, Akash, space. Okay. So the healing power of the nature, that naturopathy believes that there is no need of artificial, synthetic, allopathic, Ayurvedic medicine, no necessary. You just do some natural tricks, natural ways, then you will be get cured. This is called as naturopathy believes treating the disease produced by nature by natural way. For example, utilizing 5 elements, that's I have talked now, Panchamahabhuta, that is a Jala Mahabhut, water, mud, you know the mud, that is Prithvi Mahabhut, Sun, Tej Mahabhut, air, Vayu Mahabhut, and fasting and exercise that makes your body light. They reduce the weight, they reduce the fat, they remove the fat, then Akasha will be there. Okay. Now, history. Philosophy was used in the Hippocratic school of medicine about 400 BC. Like in Ayurveda, Charak is having 5000 BC. That is longer. And this is 400 BC before Christ. They used the term Vishamedicatrix nature. That is a typical, that particular word of Latin or Roman origin. You forget about this word. The term nature cure, nature care, this is very important. This is easy to remember. Nature care, this word has been invented in 1895, Dr. John School of the New York, America. In America, there was one doctor, Dr. John, and he has in 1895 gave the word that is nature care. Okay, let us move further slowly and steadily because we want to keep our skin very safe. So here you can see Panchamahabhut Siddhanta. Mud therapy related with the Prithvi Mahabhuta in Ayurveda. Hydrotherapy with water, Jala Mahabhuta. Then halo therapy, different names. Halo therapy is like a fire. That is heat therapy. I can say heat, giving the heat. For example, we give the warm by a hot water bag. You know, hot water bag. Yes, we put the hot water in the bag, and that we put when they were backache. Patient is complaining of backache. If patient is complaining abdominal pain, then what we say? Take this fomentation. So this fomentation is nothing, is naturopathy, is Agni Mahabhuta. Air bath or giving into the open air, walking into the open air, that is Vayu Mahabhuta. But of course, nowadays it is very, very risky to even walk or run in the cities like Bombay or the Delhi. You are seeing the different videos on the different channels, social media, that in this moment in India, at least it is said that Mumbai and Delhi are very, very polluted. So that's why the people are running towards the nature or the forest and going into the forest where there are a lot of trees, especially in the cities like Bombay and Pune. We go to the gardens. At least in the garden, there is a little bit less air pollution. In spite of moving or walking on the traffic roads, better I will suggest for the naturopathy, the patient must visit to the garden because the trees, green trees, are absorbing carbon dioxide and giving oxygen. All these things you can write in the examination, no problem. Then fasting. What happens with the fasting? You reduce your fat. And there is a more open space and lightness in the body. Akash is a space. Next, first will be hydrotherapy. Father of hydrotherapy is a specific name, Louis, is the name of the scientist. Importance of water. Water is very important. As drinking, you know, bathing, you know, washing of the hands in the corona, you know very well. Is a universal solvent. Universal solvent. Inexpensively available. There is not much expense. Of course, this is now a little bit problematic. In some areas, even in the Maharashtra state, even in the India, some part of the India, there is a less rain, drought is there, and the people have to take the water. They have to purchase the water. Oh my God, yes. So, but relatively, I am saying relatively, in spite of the medicines, water is very cheap in that way. Some places there is no, the corporation is coming, we are giving the tax and all these things. So water is not that much costly as like the antibiotics and the medicines. That's what the naturopathy believing. Okay. Then available in large quantity, there is no problem. Non-toxic, Because some medicines, they can have the side effects or the complications, anaphylactic reaction, penicillin injection without testing, person can die. So this is not happening with the natural therapy. Problem are less, soothing, very, very pleasant. It promptly absorbs and holds the heat. So it is, water is always anti-pitta. Write down, water anti-pitta. Whenever there is heat in the body, lot of heat, burning of the eyes, put the coolant strips on the eyes. If there is a burning of the urinary tract infection, you can just take a avagaha bath, tub bath, and lot of cold water around your genital. You make a flow, jet flow of the cold water on the genitals, on the urethra. Burning will be definitely less. So there is a lot of things. For example, if the menopause after 45 years, the lady stops the menstrual cycle, that is called as a menopause. Hot flushes, always feeling warm, then she should not take the warm water for the bathing, she should take the cold bath. So there are a lot of uses of the particular bath. Okay. Now, again, I have had to move little screen on the left side, and I will try or mark some points for you so that you can easily see, concentrate. Please, in spite of moving your eyes here and there, concentrate on that marked part by Deshpande. Okay. Principles of hydrotherapy. Tattva, Chikitsa Tattva in Ayurveda. Local use of the warm water. What happens? Relaxation of the muscle tissue and dilatation of blood vessels. Two things are there. Blood vessels are dilated and muscles are relaxed because they get a lot of nutrition and the waste product is removing out. Ama is going out. Ama, Ayurvedic word. Ama is like a toxin-like material created due to faulty digestion or faulty metabolism. And Ayurveda says, because of that ama, there is a strota avarodh, Srotas is blocked, and that blockages is removed by giving the hot fomentation. In Ayurveda, it is called as Svedana Chikitsa. Please write down, my dear friend, because every time in yoga, in naturopathy, anything, you have to correlate with Ayurveda. Then the examiner will be happy. Okay, so this is Svedana Chikitsa in Veda. So it improves improve the local blood circulation, local use of, first, where we can use the warm water. Please write down. Warm water, Svedana Chikitsa is best for, please write down, Vata and Kapha dosha problems. Please write down. Vata and Kapha dosha problems. One or two examples you can write down. Yes. What are the Vata problem? Always pain. P-A-I-N. Pain is equal to Vata. Pain, Vata Prakop. For example, pain in abdomen, back pain, cervical pain, lumbar pain, cervical spondylosis, lumbar spondylosis, ankylosing spondylitis. These are the musculoskeletal problems. In musculoskeletal pain problem, hot fomentation by hot water bag or infrared lamp is naturopathy treatment. If you are obesity, like this, overweight, then drinking all the time, 24/7/365. If you ask the patient, whenever you feel thirsty, only warm water. You have to drink, make a thermos, and all the time you drink the warm water, 100% weight will be lost. I'm sure about it. Try it. Make an experiment, challenge. But the patient has to drink a warm water. Little bit test problem, but if somebody can take it, fantastic. Then another important thing, kapha problem. Lot of cold and cough. And here, lot of congestion is there. Just put the warm things over here. Towel, you take the towel, make a hot on the hot plate, and just make a fomentation like this. Feeling well. This nostril obstruction goes away. You can breathe properly. Vasodilatation. So we have talked about the uses of the hot fomentation, naturopathy. We are discussing naturopathy. But most of the things Ayurveda is following the naturopathic Siddhanta. Okay. Then local use of the cold water causes the contraction of the blood vessels. Contraction of the blood vessels. Just now I have mentioned whenever there is a lot of heat, lot of heat in the body, then you can, for example, eyes are very hot and burning, or hands are burning. Give the cold compresses. That is called as the cold compresses. Even bleeding is there. Pitta problem. Cold is useful for the pitta problem. What is this talking? I am talking about. Please write down. Samanya Vishesha Siddhanta. Samanya. Please write down. Vishesha Siddhanta. Samanya Vishesha Siddhanta that we are talking about. Okay. So you have to. Pitta is a Pittam Sasneha Tikshna Ushna. So to reduce the Tikshna and Ushna, we are giving the cold compresses. When there is a hot fever, very, very high fever, we always put the cold water strips over here on the hair here. That is cold sponging. Cold sponging. This is naturopathy. Okay. Then usage of the warm water in the hydrotherapy, internal for drinking. Whenever there is, you can use as an obese person drinking. Then you can give the enema in naturopathy. Only warm water enema. Then steam inhalation in the kapha problem. Very useful in cold and cough. Vicks inhaler. That steam inhalation. Then externally, in Ayurveda also there is a Nadi Sweda. Remember, Nadi Sweda. Nadi Sweda is a, the pressure cooker, remove the whistle, put the rubber tube, then boil the water with some ginger or the Nirgundi Patra, and then give the fermentation on the back. That is best treatment. Then steam box. You might have been seen in your college, steam box. Whole body Svedana. That is all the naturopathy. Okay. Externally, you can use for bathing purpose, compression and the packs. Bathing on the basis of temperature, hot, cold, alternate, neutral. Any type of the water you can use. Simple warm water, simple cold water, or some time cold and sometime hot. That also is a part of treatment. On the basis of body part, whole body, you can use the treatment, or you can use the localized treatment. Only on the knee joint, fermentation. Only on the back, that is called as the local treatment. Sthanika Chikitsa in Ayurveda and Sarvadehika Chikitsa. Local, for example, in the anorectal problems. Anorectal problem, please write down. Whenever there is a severe pain because of the parikartika, anal fissure, the patient is asked to take the sitz bath. Please write down. Sitz bath is for anorectal problem. Anorectal problem, sitz bath. Then spinal bath. Whenever there is a back complaint, cervical, lumbar spondylosis. Head bath. Head bath. And the foot bath. Just keep your foot in the warm water. That can reduce the pain in the lower legs. Calf pain is reduced by putting your legs till the knee joint in the warm water with the Saindhava. A little bit salt. Next, we will go further. We are discussing the, please write down naturopathy. Okay, Jala Mahabhut is complete, my dear friends. Prithvi Mahabhut, mud therapy, mud pack or mud mask. Now here, I request every viewer, whoever is seeing, if you want to understand these, whatever the discussions, I kindly request, please find out the nearmost naturopathy center around your house. Please try in the Google search map. You find out nearmost your naturopathy center near my house. Then you will get some addresses. Then at least on the weekends, or at least in public holidays, Diwali vacation, summer vacation, you please, in spite of going here and there, you go to that naturopathy center by just taking the appointments and see all the procedures. Then only you can understand it properly. Otherwise, only reading and mugging up, no use. Unless and until you see by your eyes, do it by yourself, you will not understand. So visit to the naturopathy center. Of course, that is the part of your curriculum. I know that. But if it didn't, then you do it by yourself. And it is not only one time. You can visit n number of times if the place is near to your house. Go there, take the appointment, make your I card and request that authority. Sir, can I help you? Can I do this by my hand? they will allow you. Okay. So mud therapy, mud pack or mud mask, mud bath, and internal use also. But this internal use should be done very cautiously. Purity of the mud and clarity and all these things have to be yellow mud, for example, contains sulfur, and that is useful for skin problems. Okay, that in Ayurveda there is a Gandhaka Rasayana tablet for the skin diseases or blood purification. We use the Gandhaka Rasayana tablet. Gandhak is a sulfur. Huh? Then black mud is used for poisoning cases. Take out the poison. If it is a scorpion bite, then apply the black particular mud. Even whenever in the honeybee sting is there, then immediately if you apply the black mud, that gives a very fantastic results, cooling down that local pain. White mud is useful for neurological problems or hepatic problems. Then red mud is used to remove the fatigue or pain or rheumatic conditions like joint pains. Sandy mud, that is used for the snake bite and also for the gastroenteritis, the lap or the paste on the abdomen. Again, I am saying, my dear friends, just reading and just hearing by Dr. Deshpande is not useful. You will have to go naturopathy center many times. See those things, do it by yourself, and then you will be master in that particular case. Now, next we will go for the heliotherapy or the sun bath. In simple, you make it equal. HELIO, heliotherapy is equal to sun bath. Sun bath. Foreigners, German people, American people, they get a very less time for proper sun, proper heat in their countries. Indians are very lucky. We people are really lucky because that fresh and bright sun gives a lot of energy to physical level as well as to the mind level. Naturally, ultraviolet rays having the vitamin D in morning, early morning, I'm saying, not in the afternoon, very hot sun, early morning sun. That particular heat is very useful. That rays are very useful because they can provide you the vitamin D, and which is useful for the calcium, then absorption in the intestine. So all these things are called as a sun bath. Even the people in the Europe, they go on the beaches. Whenever there is a sun, they are so joyful. They rush to the beaches and throw away their clothes, and they lie down on the beaches. That is a part of the naturopathy. Even some people, they want their skin to be tanned. So this is all about the sun bath, importance of sunlight in the prime source of energy. Most vital element required for all living things. Vitamin D is synthesized by the skin in presence of sunlight only. Even you will be surprised to know, in India, I have read research articles. Try to understand these all things you can write in the exam, no problem. Many neurosurgeons or the cardiac surgeons, they have to start their day very early in the morning. At 5 a.m., they have the surgery, neurosurgery, brain surgery, cardiac surgery, and the surgeries are very long. And they have the repeated back-to-back patients, so many patients in a day, and they just return at home with a little bit tired at 7 or 8 p.m. So they start in the 5 in the morning and they come back at home at 7 and 8. Whole day they are either in the surgery room or either in the hospital rooms or in the consultings and all these things, but they are very less exposed to the sunlight, and that is becoming the problem even for the doctors like neurosurgeon and cardiac surgeon. Very interesting things to be noted. Okay, now just to give some time to me, very slow and gentle. One should keep some patience. Whenever one want to learn anything, always patience is. So here, just complete the sun bath. Morning sun bath, very important. Mid sun bath and waking sun bath. Trunk pack sun bath. Whole pack sun bath and Q's sun bath. These are the typical treatments that you have to read again in your textbook and find out or prepare the notes, because all the points are going to ask in the examination. Now we are talking about the naturopathy. We will shift to the massage. Let us talk about massage. In Ayurveda, it is called as a snehana, bahya snehana. Please write down. External oleation. O-L-E, oleation, external oleation. Bahya snehana, S-N-E-H-N. Massage, nowadays the whole body massage, oil massage is very popular in the society, because that is the most. Ayurveda says, I am first also always correlate naturopathy and Ayurveda. Abhyangaha acharet nityam. Now, in after few days, say for example 7 days, you will get a Diwali vacation, Diwali festival, festival of the lights in India in the month of November 2023. Okay, so in that period, the people are in the first day, especially Naraka Chaturthi or the Padwa, their mother used to massage or give the oil application to the son's daughter or the son. And in the Padwa, there is a tradition that the husband, wife, always apply the oil to the husband, because I think this is a traditional thing. I cannot comment much on that, but Ayurveda has a principle that oiling to the body is most essential, like we do the oiling to our vehicles. Because whenever we use the vehicle, accelerator, brakes, and clutch, and all these things, there is always a friction. Vata dosha. Whenever friction is there, there is a wear and tear. WEAR, wear and tear. Marathi मध्ये आम्ही त्याला झीज म्हणतो. Body elements are decreasing, degenerating, and to regenerate, to rejuvenate, oil is the important thing. That's why in the car also there is a coolant, there is oil. Similarly, in our motorcycles, motorbikes, everywhere. Why we put our these things in the garage? Garage to oiling, to lubricate the vehicle. Similarly, our body is also a type of machine. There is a vata dosh. Lung, heart sounds, muscular movements, hands and leg movement, musculoskeletal, neurological, everything. The vata is activity. Vata activity from birth to death. And to vata is tatra ruksho lagushitaha sukshmaschalo nilaha. There is a rukshata, dryness, degeneration. To prevent that degeneration is like an anti-aging program, not to become old. We have to compensate by Samanya Vishesiddhanta oil application. Sesame oil externally and internally cow's ghee, GHW. So both the way you can lubricate your body. And whenever you do the proper lubrication, naturally your quality of life and quantity of life both will be natural or maintained. So take care that massage, systemic rubbing or manipulating or handling of various body parts with the certain material, that means like oil or the powders or without them, is known as massage. Even if you just like do like this, whatever I am doing right now is also a type of massage without taking any oil or any paste or cream or powder. No, only moving my hand. This is also a part of massage. Types of the massage on the basis of system. One is Ayurvedic massage and another is a Swedish massage. Now you can, as I am repeatedly telling you, my dear friends, here I must remember that on the Google Play Store, there is a different apps, and Professor Deshpande, that is myself, has prepared for you, for all the students, Ayurveda Academy mobile app. Ayurveda Academy mobile app. Free download is there. So what is your problem to download? At least download it. And then you will get nearly 12 programs in a very, very economical way. There is one program which is called as a Learn Panchakarma. Keralian Panchakarma. Learn Panchakarma. Very cheap program. Some 300, 400 per month or some subscription is there. Please purchase that program. All the treatments are shown. Many PPTs are there. Lot of information is there in English, and you will learn Ayurvedic Panchakarma fantastically. It is better than your textbook, because whatever we have given you, the material, study material, is purely practical, most practical. Which oil, when you have to use, what are the Virechana, what is the Shirodhara, what is the Kayaseka. As you know that 20 years I visited to the foreign countries. So naturally I have a lot of experience in all these things. So please purchase that Panchakarma program and you will learn a lot. Okay. On the basis of the material used, sometimes we use the oil, especially according to season. When there is a very hot season, you can use the coconut oil, especially summer season. But in the winter and in the rainy season in India, you can use the sesame oil. Okay. Then you can use the Rasnadi powder. Rasnadi powder, Udvartana. Then you can use the paste. Then dry massage is also possible. Swedish massage has 7 movements. Touch, simple touch. Then stroking. Then friction, like that. Okay. Then needling. Then percussion, vibration, and joint movements. So in the Swedish massage, all has to be done. Touch, stroking, friction, kneading, percussion, vibration, and joint movements. Okay. Now, we will go further. So this is one of the questions that may be asked in the naturopathy. We are talking about the food or the diet in naturopathy. Ayurveda has given a lot of importance to the food. You immediately recall Ayurvedic concepts of the food. There are 7 types according to the Vagbhata. Shukadhanya Varga, Shimbidhanya Varga, Ikshu Varga, Jala Varga, Dugdha Varga, Mutra Varga. Please remember all these things. Because in Swasthavritta, there are a lot of questions on the diet, on the food, classification of food. Then Ahar, Ashtau, Ahar, revision. This is revision. Ashtau, Ahar, Vidhi, Visheshayatan. Repeating. Please write down keywords. Keywords means that is a must to study. Ashtau, 8, 5 and 3. Ahar, Vidhi, Visheshayatan. For example, Prakriti, Karana, Sanyog, Rashi, Desh, Kal, Upayoga Samstha, and Upayokta. Either make the clip or the audio. Okay. Then there is Ahar Vidhi Vidhan. Please write down. Second word, keyword. Ahara, Vidhi, Vidhana. Vidhana means rules. Rules of eating. Rules of eating. Ushnam Ashniyat, warm. Snigdham Ashniyat, little bit anxious. Fatty, ghee. Matravat Ashniyat. Nati Drutam, Nati Vilambitam. Ajalpan, Ahasan, Tanmana Bhanjit. Oh, sir, you are giving a Sanskrit shloka. Yes, my dear friends, some shlokas are very important. You have to see this video again and again. Go to your textbook, find out that shloka, write it down. You will get the good marks. Okay. Diet is a particular selection of food and drink that is consumed to maintain the life, quality of life, provide a lot of energy with the carbohydrates and fats, promote the growth with the proteins. Okay. Positive food, primary food, vegetables and fruits, alkaline in nature, light in nature, easy to digest and easily digestible, contains the fibers. When there is a fibers, it's good for the stools, laxative, morning, good morning, defecation, best defecation. Then negative food. What is negative food? Positive food and negative food. Sattvika food and Rajasic, Tamasic food. Secondary food like cereals, grams, nuts, milk, egg, etc. These are acidic in nature, heavy to digest, and contain less amount of fibers, and that is constipating. Malavashtam, hard stools. That is very bad. Okay. Let us move further. Okay. Fasting. In Ayurveda, it is called as a lNaturopathy Chikitsa. Please write down. lNaturopathy Chikitsa. Okay, Langhan, fasting. And Ayurveda says whenever there is a kapha problem, whenever there is an ama problem, whenever there is a srotorodha problem, then best is to do the fasting. It can be without water or it can be with water. Nowadays, you are seeing that different political issues, debatable issues are coming, and a lot of people are doing the fasting for their political benefits or the social benefits. Okay, but in Ayurveda, it is also important for our health. Okay, fasting is defined as a complete, intentional, purposefully. It is not like undernourishment, because in the some slum areas, the people are not getting enough money and enough food to eat. That is not a fasting. That is why the word is important. Intentional. I have decided that I have the food to eat, but I will not eat. That is intentional. Abstinence, not taking from consuming any kind of food articles for a specific time frame. Some people do it for example, 1 day. Some people are doing for the 7 days, like that, in order to provide the rest to digestive system. Most important benefit is a rest to digestive system, because rest, giving digestive system, is like a recharging of your battery. Where, for example, your mobile, and you keep it for charging. Most time when we put the mobile for the charging, we are not using it. So it is a rest to the mobile. Am I right? Similarly, when we are not using digestive system, it is a rest to the digestive system. And then it starts recharge, and it automatically starts more good functioning. Okay. You remember when I was talking about Panchakarma, I think in Charaka Uttarardha, there I have mentioned one important concept. Any Panchakarma, Vamana, Virechana, Basti, Rakta, Moksha, Nasya, Purva Karma is there, Pradhana Karma, and the Paschat Karma. Purva Karma, Snehana and Svedana. Pradhana, main procedure, Vamana, Virechana, Basti, Rakta, Moksha, Nasya, and Paschat is a Sansarjana Krama. Do you remember that? Sansarjana Krama, that means step by step taking the diet within a period of 7 days after Panchakarma, from light diet to the normal diet. Immediately, suppose I have done my today Vamana. Today evening, I am not expected to eat normal food. Today also, I am not expected to eat the normal food. Then what I have to do? Today, for example, only little bit soup, warm soup, whole day or in the evening. That's it. Tomorrow also, I have to use only rice water for the whole day. That is Manda, Peya, Vilepi. You remember these words. Akritayusha and Kritayusha. Manda, Peya, Vilepi is called the Yavagu. That is only from the rice. And Yusha is always from the Munga dal, green gram. Akrita, without processing. And Kritayusha, आम्ही मराठी त्याला फोडणी दिलेलं म्हणतो, जिऱ्याची फोडणी द्यायची, seasoned. So whenever we don't do any processing, that is akrita yusha, and otherwise it's a krita yusha. So step by step, and after that we have to take half chapati, khichdi, and then normal diet. So elimination of toxins, that is amapachana. Please write down this word. Amapachana is very important, because amapachana is called srotorodh. And whenever there is agnimandya, whenever there is ajirna, indigestion, is the biggest problem. One important shloka I am telling, 3 times I will say, please write down. Rogaha, Rogaha, Sarve api, Mandegnau. Rogaha, Sarve api, Mandegnau. Rogaha, Sarve api, Mandegnau. What is this? Sir, what is this? Rogaha, Sarve. All the diseases, any disease. From cold, watering from the nose, to the cancer. From cold to the cancer. They are because of the agnimandya. Faulty digestion, faulty metabolism. This is Ayurveda's basic principle. And to correct that, this is the best naturopathic treatment, lNaturopathy Chikitsa, fasting. Cessation, end of numerous digestive problems like agnimandya, ajirna, vilambika, visuchika, grahani, amlapitta, all the diseases, they will be get cured. Okay, irritable bowel disease, irritable bowel syndrome, nowadays very common, irritable bowel syndrome. Reduction of deposited fat, that is obesity, will definitely come down if you start the fasting. Okay, weight loss. Very interestingly, I will add one thing. There is some tricks, because to control your hunger is very difficult. Very difficult. Then there is another one can do the, at the lunch and dinner, you specify some your food. For example, in the morning, I will eat only 2 chapatis. In the evening, only I will take 1 chapati. Okay. So you have to take only 2 and 1 chapati. That's it. And for example, half or the 1/4 vati or the pot of the rice. That's it. You eat that, and whenever you have more hunger, you can eat a lot of salad, cucumber, carrot, onions, make the chops, and lot of salad. That is a sort of fasting also, taking a less food than whatever you want or desire. Then you can drink a lot of soups. That is also very good part of the doing the fasting. Okay. Last part of the naturopathic treatment is called as a Vishrama Chikitsa. Nowadays, this is also very essential, my dear friends, because all the people are running and running and running. They're running? No, we are going to the college, sir. We are going to the evening, sir, dispensary. No, I am not saying. Running means physical and mental. They are always occupied and busy. Nobody has a time. Nobody has a time. And have the time, but that is wasted on the social media. Just looking the reels and mobiles and gaming. But that is also occupied. Your mind is always occupied. I say always. Very, very interesting statement. Please write down. You can write it in the exam also. Fast food. F-A-S-T. Fast food. Fast. Easy to cook. 1 minute cook. Noodles. Maggi. Soup. Maggi noodles. Okay. Easy to cook. Fast food plus fast lifestyle. Fast food plus fast lifestyle is equal to fast food plus fast lifestyle is equal to fast death, total body death or fast death of the cells. That means early degeneration, degeneration, wear and tear, early aging. You become earlier older. Ideally, you should be old. For example, for the God's sake, my father is 91 and still very okay, or not handicapped. But even young people, they are suffering from the backache, neck pain, sir, tired, sir, joint pain, sir, obesity, sir, BP tablet, this and that. Why? Because fast food plus fast lifestyle is equal to fast death of the cells, early aging process. And to avoid that, here is a relaxation, rest therapy, lying down in Shavasana, okay, meditation, sleeping, proper sleep, minimum 6 to 8 hours sleep, sits bath, spinal bath, listening to the music. In Ayurveda, it is called as a Gandharva Chikitsa, Gandharvas, music therapy, fantastic, soothing music, not soothing, cool and calm, satar, flute, etc. Pursuing the hobbies, yes, painting, dancing, writing, reading, walking. Hobby, you must have some hobby, okay? Benefits, reduction in the metabolic rate of the body, BMI, basal metabolic rate, reduction in the blood pressure, BP will be down, regaining the strength, enthusiasm, and happiness. These are the recharging of your body. That is a Vishram, relaxation. Okay. So, my dear friends, nearly this is the end of our lecture. And in today's lecture, we have seen basically different types of the naturopathic managements or the chikitsa. For each of these topic, you will have to prepare your own notes. You can send me all the time WhatsApp. My WhatsApp number is 922681060. You are always welcome. I can just say received and I will say okay. But that will give you the best push that I am. So fasting Langana Chikitsa is always asked. We are going back. Then this particular sun bath is always asked. Surya Snan, write about Surya Snan. Mud therapy is also asked in the examination. Then about the massage, Abhyang. Ayurveda says Abhyangha Acharet Nityam. Every day one must have the massage. But if not possible every day, you can do at the weekends or in the holiday also. Then the diet therapy, food is your medicine. This is interesting title. Food is your medicine. Then there is a Jala Chikitsa, that is hydrotherapy that we have seen. Then we in the back we have hydrotherapy, Panchamahabhuta Siddhanta. Then we have seen what is the naturopathy. Before that we have talked about the Naishthiki Chikitsa, which is like mental, making your mind very strong and avoid the greediness and craving for the different things, Trishna, because that is the root cause of many diseases. according to Ayurveda. Then we talked about the last part of the yoga, that is the Shata Chakra, Muladhara, Swadhisthana, Manipura, Anahata, Vishuddha, and Ajna Chakra. Here is Ajna Chakra. Here is the Ajna Chakra. Sorry, here is a Vishuddha Chakra. Huh? Okay. Then we have talked about Mahabandha, Mulabandha, and Jaladhara Bandha, Uddiyana Bandha. Then we get talk about a lot of powers that we gain from the yoga. That is Avesha, Chetaso Jnana, then Arthanam Chandataha Kriya, Drishti, Shrotra, Smriti, Kanti, and Svecha, others invisible. Like Mr. India. You know that Sri Devi was when, no, I think I just forgot the name. He just bind some wristwatch like thing band, and he was becoming invisible. So something like that. I think Anil Kapoor was that. So that particular cinema, the Swechha Adarshan, invisible by your own will, that can be possible with the yoga person. As the yoga says, nowadays it is very difficult any person to get such a Siddhi, Ashta-Siddhi. But in the examination, they will at least ask you what are about this Ashta-Siddhi. So my dear friend, this is all about the today's lecture of 11:15 to 12:15 of Swasthavritta. Paper 1 we are talking about. And then in the afternoon, we will talk about the Charaka Uttarardha that we have started with. We have completed Kalpasthana. You have to make the Kalpasthana notes like Madanafala Kalpa, then Vachaka Kalpa, etc. And we have started now Siddhisthana, which is related with the Panchakarma indications, contraindications, and complications. We will Charaka Uttarardha, we will study in the afternoon. Thank you very much. Take care and see you soon.